That come from behind victory that put Republican Scott Brown into the Senate seat that was held by Teddy Kennedy in Massachusetts for decades. It has just thrown Democrats into utter turmoil when it comes to what they're going to do about health care reform. Because of that election, Senate Democrats no longer have that 60-vote filibuster-proof majority that they've been relying on to move health care reform through the Senate. And because of that, it seems the ball is very much in the court of the House of Representatives. We've been paying a lot of attention to what House Speaker Nancy Pelosi has been talking about as the way forward. She closed the door on the idea of the House just passing the Senate bill outright and putting it on President Obama's desk. That seemed like the easiest route to go. But some of the other ideas, one being taking the Senate bill, changing it a bit, and using a procedural tactic that would allow the Senate to just rely on a simple majority of 51 instead of 60 votes to pass it. The issue with this for Democrats is it would be a huge political risk. You would have Republicans saying that they're doing something under the radar and it's not on the up and up. And so it seems like, lastly, their option would be to take some of the items of health care reform that do have some broad support, try to get some Republicans on board, pare down their efforts, and try to move that. Maybe they could salvage some items like telling insurance companies they can't deny coverage on the basis of a pre-existing condition, or telling insurance companies they can't cap benefits for Americans either over the course of a year or over the course of a lifetime. Maybe there would be something in there that could encourage people to get insurance, but not outright demand that they do it. And because of that, there would also have to be some assistance in the form of subsidies to help low-income and middle-class Americans get health insurance. All of these details unclear at this point as Republicans really lick their chops over this newfound influence they have on health care reform.